So what we do know is 6 feet is not sufficient. And there was definitely a goal, not just again with the health department, but with members of the Back to Business group to assure that sports venues could open and have fans. So we could have issued a directive to not allow fans. So that was sort of our beginning conversation. Is it safe to have fans or not? Particularly given in July, which when many of these were being reviewed, our cases were going up exponentially. So we committed that we wanted to try to work with the industry and different venues to come to a safe place to allow for fans to be able to be there and participate, but reduce the likelihood of transmission. 6 foot really is used for very casual contact, and I want to continue to reinforce that. 6 foot is for casual contact. It's not when people are yelling. It's not when people are in very close contact yelling. It's also not when people are actively or potentially actively engaged in drinking alcohol. So then we originally began to look at indoors versus outdoors, and then came to the place that really 12 feet was a fair number. We actually went between 10 feet and 12 feet, and that we also were looking at the capacity piece, and that could get to limited capacity and around 12 feet. We also initially said that indoors it needed to be much further, which is 18 feet. Very consistent with music venues. That's what we said initially for indoors, but have reduced that back to 12. We will continue to look at it, and that's why data is so important locally, is that as these venues are opening, we can begin to gather data to see if we are having transmission in those facilities or not, and go from there. The other thing that we looked at is what's called zoning and cohorting, so that in some places you can keep groups to a small area, but to do that scientifically, you actually have to have a lot of knowledge about the way the air conditioning units work indoors and how their other airflow works. And there just wasn't sufficient information to go with a zoning approach, and so we agreed collectively that based on the data we had, 12 feet was a fair distance and still allowed for facilities to open.